Hi, it's Dr. Noel Robert Williams. Good morning. April 19th, 2020, COVID update. Uh, First, we're going to start with some non-COVID stuff very quickly because I think I've stirred the pot, which was my goal. And I want to talk about scientific discovery and questioning. And a big shout out to Kim Willis and Dave Hickson, who's questioned some of the things I've said. I appreciate questions. You all are awesome. Thank you very much. Um, we have to question, we have to challenge, and we have to think when we're in a situation like this. So, just without spending any time on the details, one of the key things in science to understand historically is that any new scientific discovery goes through three phases. Phase one is ridicule. Phase two is violent opposition. And phase three is complete acceptance, and how could have you ever questioned that this wasn't true? And so when we see the things about the COVID-19 and its source and genetic manipulation questions, what I've seen is the first two without any science. And that's why we have to ask the question. And if you've been following this as closely as I have since January, really around the 10th to the 15th is when I really started to dig, but I was paying attention from the very beginning, even when the first reports came out in December. You can see the trend of the standard scientific approach to anything that's new or a new concept is, or a new idea or a question is violent opposition and ridicule. And I can tell you in my career as a gynecologist for the last 25 years, that's what I've experienced at times. And this isn't a toot your own horn kind of thing, but just some very basic examples. I was the first gynecologist to ask for cystoscopy privileges at Integris in 1994. That's putting a little scope into the bladder. It's the easiest thing in the world. I had training in urogynecology, blah, blah, blah. First, I was criticized by all the urologists very, very strongly and made fun of. Then when it went to medical exec committee, there was unbelievable violent opposition, and really hateful things were said about me and all that kind of stuff. But then eventually David Kallenberger, who's still there, got it through. And now 25 years later, every gynecologist, not only in Integris, but throughout the state, has cystoscopy privileges. But they all acted like I was a criminal at first, like I was trying to kill the Pope, even though I had training. And I have many other examples like that. My favorite, probably long-term one, is I introduced natural hormone replacement therapy into Oklahoma because that was just an interest back in 97, 98. And now it's the standard of care here. That's how practically everyone does it. But through the years, I was made fun of, ridiculed, violently opposed that I was doing things incorrectly, even though the science was right. And at one point, the OSMA, Oklahoma State Medical Association president, even wrote an article in their little magazine saying how doing it that way was completely wrong, and anyone who did this was not following science. And it just was funny because it's just not true. And now it's, of course, the standard of care. And the final one I would mention is most recently is just medical marijuana. I led the charge for that in our state from a physician point of view. And again, ridiculed by other doctors and other people, both in and out of medicine, violent opposition. The OSMA, again, took a stance that anyone who was for this was completely insane and wrong. And now it's 2 years later, and I think there's a general agreement that it's been very positively impactful. Not that medical marijuana or marijuana in general doesn't have negatives, but in terms of medical care, it has some significant positives. So it just illustrates, if you're someone who's a change agent in questions, you sometimes are going to have problems. And so in the end, Dr. Montier, if I'm saying his name right, may be completely wrong, as are the people who think it's a synthetic virus, but we have to ask the question, is my point. And that's what we have to do, and we have to put it out there and challenge and bug people and be like Socrates, a gadfly, an irritant, to make people do their jobs. So that's kind of the point of all this. And I'm going to have a post about someone today, Ignaz Semmelweis, who's really the father of germ theory, and I would encourage all of you to watch the YouTube because it will define this very clearly. So let's talk about COVID. So COVID, I think the statistics are really hard to interpret anymore because the numbers are getting so huge, and the epidemiologists from the University of Washington, the CDC, who influence our local people very dramatically, appropriately, I want to add, because big scientists giving information to local scientists, but it's a mess. They've changed the surge date so many times now. I have no idea, but it looks like we're leveling off in Oklahoma. We had an increase, a little bit of our cases, but only 3 more deaths yesterday. So we're at about 136, I believe, and 2,600 roughly cases. We still are having tremendous testing problems, and that's universal in the United States. Everybody's having that. There are 736,000, 740,000 cases, so a massive number, not quite 40,000 deaths. In the world, I think we're at 2.4 million and 165,000 deaths, something like that. So the numbers are huge. It's getting really hard to keep track of. And as the disease events getting into Russia and some of these other countries, the reporting is just going to be terrible. So I think the big change for us to start on now with COVID is not so much where we've been, but where we're going. Because it's, as Winston Churchill said, this isn't the end, but, and I'm paraphrasing, but perhaps this is the end of the beginning, which is a post I put up before. So now we're going to be in this new phase of liberalizing activity. And liberalizing activity is very important. We need it, one, for sanity. We need to socialize again. I know we've felt it in our house, and I'm sure a lot of you have too. My 13-year-old probably most of all. He actually misses school, which is will be great for the rest of our lives. But how do we do that? And how do we do it safely? And that's what we want to focus on now. So safety with integrating means you need a mask. You need a mask to protect others in case you're an asymptomatic carrier, or if you have a slight cough and you think it's allergies and it happens not to be. The mask protects you from spreading or lowers your risk of spreading the virus. And number 2, it also protects you from getting the virus. Now, in a perfect world, we'd all have N95 masks. That is not going to happen, obviously. But just a cloth mask, and if there's a slot to put a PM2 filter, that's great. But even if you don't, that is somewhat protective. You want a mask, you want to wash your hands all the time. If you can get a hold of some hand sanitizer, and I think there'll be more hand sanitizer around in the next few weeks because production's catching up. You want to wash your hands or carry some hand sanitizer with you, and you want to keep some social distance. Don't sit right next to someone when you can sit further away. Very simple stuff. I think those are the key things to focus on moving forward. We are going to have a basal rate of COVID infections across the world over the next 4 to 6 months. There'll probably be some pulses up. It's how it is. There's nothing we can do about that. I think at least in the northern hemisphere, particularly in states like Oklahoma and Texas, where it gets really, really hot in July and August and the beginning of September, we probably will have some downturn. And it's not because as much it's seasonal, it's just heat and dry heat. It is a little bit inhibitory, it looks like, to COVID. It seems to do better at about 42 degrees. Now, it can still grow at 95 or 100 degrees, but it's just harder, and the surfaces get drier, and the surfaces get really hot too in the sun. So it will be a little more inhibitory, I believe, in the summer months, especially July, August, and beginning of September. But there will be a baseline level of infection everywhere, and there'll still be people getting sick, and there'll still be people dying. Likewise, there'll be more data on all these different medications. I'm going to put a post on, or just a reference to a journal article that summarizes all the different treatment strategies. I think the thing we're going to find with Plaquenil is that it has a good role for prevention, and it probably has a really good role for early use. The data that has come out with people who are really sick. It's not helping that much, or may not be helping that much. And the reason is, most likely, once you get the infection and you get into the phase over here where you're super inflamed and all these cascades of inflammatory mediators are filling your body, that is self-perpetuating. So getting rid of the virus is not going to be as helpful at that point. So some of the other medicines are going to have a better role for that, and there's some antivirals. There's a rheumatologic drug that was picked out by AI, which I've mentioned already, and there's several others that both has antiviral effects, but it also simmers down the immune system. And that's one of the things that I think is going to be a change in interpretation, since pregnant women aren't getting sicker with it. We're not seeing some huge pulse in post-cancer patients and rheumatologic patients on biologics so far. It may end up that some level of immunosuppression from these rheumatologic drugs is actually protective from serious disease. You might get it, but you may not notice because you just don't inflame. So very counterintuitive to how rheumatologic medicines and chemotherapies have always been viewed, but very interesting stuff that this virus has stood a lot of previous thinking on its head. The other thing I'm going to put a little post on is a book called Who Moved My Cheese? A great book to read about change, probably about almost 15, 18 years old. I didn't look. But I read it long ago, given it to people. Some people read it, some people throw it away pretty quickly. And it's just kind of a mindset. So just interesting stuff. So the big focus moving forward is how do we adjust to the changing environment? How do we stay safe? How do we reintegrate into a normal society? So it's masks, hand sanitizer, and social distancing. Those are the big three. We, of course, at our office will certainly appreciate anyone who wears a mask in. We're encouraging everyone to wear masks. My entire staff has had masks for 6 weeks, but 7 weeks, because I was a nerd. But again, we want everyone wearing masks if possible into our office, and I think you should wear them everywhere you go in public. So that's the summary today on Sunday. No big changes. I think we just have to stay the course and see what happens. I can't really give any accurate data on surges because it's gotten so convoluted through the federal government and these different labs that it's impossible to say what's going to happen now because there's so much conflicting data. So thanks to all my friends and all the people who have been wonderful with their posts, supporting what we're doing or trying to do, which is help people. And thanks again for all the people who ask questions, especially people who ask questions that do so in a positive tone, because I'm a very positive person, and I think you can have discourse in a way that is still friendly even though you have different opinions. So take care and good day.